What to consider when choosing health insurance for the new year. I'm Christelle from Diabetes Strong. In this video, I'll be giving you the down low on what to consider when choosing a new insurance plan. Because open enrollment for 2023 is now, and locking in the right insurance for next year is so important, especially for us living with a chronic condition. Whether you're buying insurance through your employer, through your state's exchange, or through an agent, I think there's a list of critical questions that you should be asking and considering before choosing a plan. Because choosing the wrong insurance plan can be a really costly affair, especially if you live with a chronic condition and require regular prescriptions and medical care. Since I live with diabetes, my approach to choosing insurance is from that perspective, but I believe that the things I bring up in this video would be relevant for anyone living with a chronic condition. Actually, I would argue that they'd be relevant even for people who do not live with a medical condition. This video is sponsored by US Med. US Med is the distributor that I use to get my diabetes supplies. They're full service suppliers. That means they'll handle everything from insurance verification to getting the prescription from your doctor to actually sending your supplies directly to your mailbox. They also accept over 1,000 private insurers as well as nationwide Medicare, but more about that later. You can switch insurance during the year if you have a major life event, such as a move or a new job. But aside from that, open enrollment is the time that you choose your insurance for the year to come. I'll be changing my insurance this year, and these are the things that I'll be considering before choosing my new plan. First, you have to decide which kind of insurance plan you're looking for. There are 6 different insurance plans available, and I'll be covering 3 of the more popular ones here. The first one is a PPO plan, and that's usually what I go for. So a PPO plan allows you to choose any doctor without having to get a referral from your primary care physician. A PPO plan, though, usually comes at a premium. Another plan option is an HMO plan. So in an HMO plan, you have to choose a primary care physician from their network. So you can't just choose any, you have to choose from the network, and you have to get a referral from your primary care doctor to see a specialist. So this is the main reason why I choose a PPO over an HMO. I see both an endocrinologist and I see a gynecologist. Both of those are specialists, and I don't want to have to see my primary care doctor first before being allowed to see my specialist. And then the third one I want to mention today is a POS plan. So POS plan is a hybrid between a PPO and an HMO plan. So the way that works is that you have to choose a primary care doctor from their network, but you have options for choosing doctors without a referral. They're just sometimes a little bit more expensive. Next thing I look at is whether or not the plan will cover my medications and my devices. For me specifically, that means my insulin and my CGM, my continuous glucose monitor. For insulin, I use Levemir, that's my long-acting insulin, and I use Humalog as my rapid-acting insulin. And for my CGM, I use a Dexcom G6, looks like this. The Dexcom, as well as the Levemir, this one. Those are my must-haves. That's what I absolutely need covered in my plan. Whereas for my rapid-acting insulin, the Humalog, I don't mind being switched to another brand. It doesn't really matter that much to me. You'll of course know which medications are must-haves for you, but let's just get practical here. So let me show you how to figure out whether or not the plan that you're considering actually covers your meds. So what you want to do is you want to find the formulary for 2023, and then you want to look up the medications that you see as must-haves. If in doubt, you can always call the plan and ask. But let me just show you. The way that I do it is I find the summary of benefits and coverage, and then I find the prescription drug coverage. So you can see that here, it's listed down here. So basically what I then do is I click on the link to get to the actual benefit list. Here they have a separate link, so you click that. I then download this as a PDF, click here. That way it's searchable. So now I can search for rapid-acting insulin. And you can see this shows up here. So these are all the different rapid-acting insulins that are covered by the plan. If you scroll down, it's also intermediate-acting insulin. There's short-acting insulin. And if you continue scrolling, you will see there's also long-acting insulin. So you might remember my requirement is that Levemir has to be included. So let's see. There it is. There is Levemir. So that is included by this plan. I also look to see if they cover continuous glucose monitors. This plan only covers Freestyle Libre. So you can see all the Freestyle Libre sensors that it does cover here, but no Dexcom. Next, you want to research if your doctor or hospital is in network. In my opinion, this is only really important if you're very specific about which doctor or hospital you want care from. and it's probably a little less relevant if you choose a PPO plan. But it might be a good idea to simply call the hospital or doctor and ask them if they accept the insurance that you're considering. Another thing to consider is if the plan that you're researching works with your preferred drug or device distributor. As mentioned, my DME supplier is US Med, and they're responsible for sending me my CGM on time. I have a great track record with them. They make my life so much easier, so I definitely want to stick with them. Since US Med is a distributor that I want to stick with, I also want to make sure that I choose a plan that they partner with. It's not something I'm super worried about, as US Med has a broad network of payers, but it's definitely something I look into and pay attention to. If you want to look them up, it's pretty easy. They have this list of insurance companies on their websites. So again, something you can easily check out. You can see all the payers here. And then there's the big one. What can you afford? Health insurance in the US is expensive, but not being insured can be even more expensive. I look at the following and in this order: monthly premium, deductible, copays, and out-of-pocket maximum. Monthly premium is what you pay every month to your insurance company to just have coverage. So it doesn't necessarily include any usage, just that little plastic insurance card. But I'd highly encourage you to not just stop at the monthly premium, because choosing the plan with the lowest premium is not necessarily the cheapest option. Next, we want to look at the deductibles. The deductibles is how much you're going to be paying out of pocket before the insurance company starts to pay anything. So often plans with very low monthly premiums have very high deductibles. So it's something to be mindful of, especially if you know that you're going to be utilizing your plan quite frequently. For example, let's say that you choose a plan with a $200 monthly premium. Let's say that it has a $6,000 deductible. That means that you'd be paying $8,400 out of pocket a year before the insurance plan is going to start paying anything. So maybe you find another plan that's $400 a month. So that's double up. Okay, we don't necessarily like that, but let's say the deductible is only $2,000. That would take the annual cost down to $6,800. It's still a lot of money, but it's actually a cheaper option. Also be aware that some plans have separate drug deductibles as well as overall deductibles. From the plans I've been looking at, it doesn't look like the drug deductibles are as steep, but it's something to pay attention to. Next, you want to consider your copays. So your copay is how much you're going to be paying every time you pick up a prescription or you see a doctor. Prescription copays will depend on the tier of the drug that you need. You can look up the tier in the drug formulary. Remember, that's the same place where we looked up whether or not the drugs were covered. And the last thing I look at when it comes to cost is the out-of-pocket maximum. The out-of-pocket maximum is the maximum amount that you'll be paying over the year for prescriptions and medical services. Out-of-pocket maximums are usually ridiculously high. At least they've been for my plans, but they can be really helpful in years where you might have surgeries or hospitalizations coming up. I've had 2 surgeries in the last few years, and I'd say both of those years I've hit my out-of-pocket maximum. Purchasing insurance is expensive, but remember that if it's too expensive for you, you might qualify for financial help. There's of course Medicaid if you're considered a low-income household. The exact threshold for when you're considered low income will depend on your state, and you can look that up online. If your household income is higher than your state's Medicaid threshold, there's still other options. If you go through your state's healthcare exchange, you can both compare plans, but you can also see if you qualify for lower monthly premiums. I only have experience using the health exchange in California, and I must say I was super impressed with that. It was very easy to compare plans and see if I qualify for financial help. Just be careful though. I have seen some sites that were not official health exchange sites, so just make sure that you go to your state's official site. And the final thing I want to discuss is whether it makes sense to use an insurance agent. I've used insurance agents to help me weed through the options, and honestly, it's been with varied results. The upside is that they don't cost anything, and the agents I worked with have been able to identify options I didn't know were out there. Some of them have been a little pushy, but you know what? You can always say no. Just because you work with an agent doesn't mean you have to take the advice. I do think it's worth using a health exchange agent, especially if it's the first time that you're using a health exchange. They can help you get set up, tick the right boxes, and even get you set up for lower monthly premium if you qualify. And those are all the things that I consider when choosing an insurance plan. You have time to do the research as open enrollment lasts until mid-January 2023. I prefer to get ahead of the game though. I start to do my research already here in November. I hope you find the plan that's right for you. Thank you so much for watching.